morning. I have virtually summarized just about what I have to say in about four slides there. And this is a position that we take on this very first slide. What I'm getting at here is how we see ourselves taking forward this opportunity that PEPFAR granted us. So we take the position that in the broader Caribbean context of intervention programs seeking to stem the spread of HIV and even to halt it, then we are actually working with a number of other projects, if you understand what I mean. We are liaising in some way with those other projects to see what they are doing and what we can do differently. It is out of that that we actually came up with the idea that we'll twin these two things. And not the two issues of HIV as GBV, and work with the community, stakeholder groups, primary ones such as yourselves, to actually roll out the intervention program, to work with us in terms of doing the assessment of whether or not we're making an impact. So you're going to be critically involved in this. You are here today just to have an idea of what the project will entail, what we are going to ask of you, and what we are prepared to offer you in return. We're asking, especially for a long-term commitment of about 20 months, which means if you're going to be developing a program, you have to think long-term. It may require, for example, a program activity that you have decided on that you can repeat regularly over the 18-month period, or it may require 3 different approaches to implementing the one activity. We are prepared to work with you. We do have a team that will facilitate how you roll out your project, how you budget it, and of course we'll contribute to that in terms of the cost, in terms of the resources, in terms of the technologies, and so on. So we capitalize on your participation for 2 reasons. The first one being, of course, that we know it's very common in Grenada to work with government, with stakeholders and community groups in implementing projects, especially international projects. We have capitalized on that in the design of this project. We have also capitalized on the fact that you're so close in the communities in terms of your relationship with community members, with family members and all that, that we can rely on you to simply reach out to those who are in need. Those are critical factors that we had to consider in terms of putting so much onus on community members to take this project to those who need it. Oh, you aren't hearing? All right. So we said we have precedences in doing that. We know the state reform. We have borrowed ideas from the state reform project. The state response reform project, is that how we call it? Many of you here are familiar with that. We have borrowed ideas from that in terms of the level of collaboration they have sought in rolling out their project or their program. So we have similar representatives here from government, from the public service, police, nurses, from the communities, from education, and so on. So we borrowed that idea. Also, we have some key partners in CHA. That name was mentioned before, Caribbean, remind me, Caribbean, HIV, right? And with Grenada, and with LACC, as well as HOPALS. Those are our key partners here. They're going to be contributing in their respective domain, what we need to develop appropriate project plans, alongside, of course, what you have to tell us in terms of what your interests are and what you'd like us to help you with. So we hope our partners will help us to streamline those as best as possible to keep them within our budget and within our frame of reference. We have the Ministry of Health in particular on board because PEPFAR insists that we must work with the Ministry of Health in terms of handling certain components of this project, such as the HIV testing such as the not HIV testing and the use of, I think it has to do with some kind of modus operandi in how you work with these people who are infected if we come across them in our various programs. The Ministry of Social Development, I don't know to the extent they are aware of how we intend to integrate them, but I'm sure Ms. from the Domestic Violence Unit is going to be critical, because we see her as, at that unit at least, as a point at which we can refer individuals as you come across those who are really in need, who have been abused, who have been, don't know, for example, how to get a support and so on. So we have those people in mind. We intend to get to them later in terms of developing the specific programs as we get the ideas from you that will be rolled out in the various communities over the 18 months. So I just want to put you on notice that this is the attitude that we take. A lot is going to be dependent on you as much as us, and don't really expect us to be telling just about everybody everything. As we say, we'll be offering you support in kind and financial as necessary. Now, can we go on to the next slide? Let me be a little bit more specific in terms of what we ask from you. I mentioned the long-term commitment. I'm asking you for an opportunity within your own program framework. We don't want you to do anything outside of how you operate, right? But there must be some opportunity there. Maybe you have some outreach idea, some outreach initiative that could do with some support. This is where we can enter. So you can think about how your structure is within the police stations in the various communities. There are 9 of them in total. And the nurse stations, you may have outreach program. That would give us an entry point. Just think of how a project such as this could be used. And there is where we're prepared to come in so we do not disrupt too much what you do. The long-term commitment, I said, is for 20 months I have there, but essentially 18 months. We're going to have a high point within that. At the middle of this project, we should be having a what do we call it again? As youth symposium and health fair, right? So most of what you do between now and the midpoint of this project will be projected towards that event. And the activities that come after will be rolled out towards the end of the program. So I want you to think strategically in terms of 2 actual endpoints for yourself. We have a youth symposium and health fair coming up in the middle there. And there is where we're going to highlight what is being done in the communities in terms of addressing the needs of HIV, GBV victims and potential victims, want of a better way of, clients. And potential clients, very awkward to say that, but I mean the at-risk persons of GBV and HIV in those communities. Your choice of a focus area is also critical for us. You are going to work within your comfort level. You have resources in those folders. We'll give you a lot of ideas from which to choose that is appropriate to where you are and will be appropriate to what you can do. So you'll choose from that, and out of the various presentations we'll be having this morning, you also extract your own ideas of what may be useful from your vantage point. What we offer, it's there already. Can we go on to the next one? You missed that? What we ask. Yeah, go to what we offer. Right. These are the things I mentioned already. They're small budgets. We can offer you technology if you decide that, okay, we want to do something, maybe a production. Yesterday, one of the facilitators pointed to a major production that they did against it was a Grenada AIDS Alliance when they were, when they were in operation. That organization lasted for about 9 years. That organization lasted for about 9 years. One of the major things they did, they had a production which had a significant impact on the communities and on individuals. So when we say technologies, we are thinking of things like those. In addition to, we'll get to that in more detail when the facilitator comes along. But to give you an idea, drama, theater, things like those. Suppose you want to, create some kind of production, as in the cultural, what do you call them? Those cultural groups do. You can choose them to do something for you. If you're innovative enough, you can think in terms of getting a production going that we can roll out to different groups in the community, or we can go to different places within the community and get responses on that. We may be teaching, we may be counseling, it could be anything, So just be creative here and useful. The cost on the right I mentioned, the sourcing of facilitation. Sometimes we do need speakers for events. You may need that. We can source that for you. We can make those preparations. And if there's a small cost involved, we may be able to underwrite that for you as well. Codification or thematics, well, what does that mean? Just as much as we said, that will help you to streamline your own plan, so that it fits within the broader framework of what the project is and what PEPFAR wants. And engendering and sustaining broader public interest and response is, or should I say, that is in fact the second largest responsibility of us as a project team. And what does that entail? We're going to be responsible for, as we said, for highlighting what you're doing in the communities. I mentioned the trade fair, I mentioned the youth symposium. That's going to be a one-day event. So we are going to be responsible for highlighting to the general public what you're doing in those communities, and in such a way that will have also impact on this larger group. What our rationale look like in terms of numbers, we expect at the very minimum, as a group, stakeholder groups within the various communities, you can have direct impact on about 240 persons. That's the minimum, right? And we have estimated a maximum could be as high as 500 direct impact. But in terms of the larger population impact within Grenada, it's much, much more. So we're going to be using public media, as we said, in every form that it takes to complement what you're doing in the communities. Now, the seminar today. Can we go on to the last one? The last slide you have there? Seminar? Okay, all right, never mind. Yeah. We can send that to you. That's not in your folder. These are just notes for the overview. I understand. So if we can send this to you, because we'll be in touch with you very soon after the seminar. All right. So what do we expect, or what are we doing in terms of the seminar? Well, the seminar is intended to sensitize you to processes that will be involved in this outreach initiative, the type of populations we are really gunning at, or aiming at, I should say. And we're getting some feedback as to what has gone on before. So we have a team of facilitators to do one set of presentations, and another team that will do a second set that focuses more on resource, how they mobilize resource, what is it you can perhaps use from where they are. And these two set of presentations will give you some idea what has been done before, so you can have some opportunity to move your own discourse or thinking as to where you want to go in terms of your contribution to this project. Another thing we can expect from the seminar is only one day. I'm going to take the responsibility of highlighting what comes out from the facilitator and from your participation in the discussions that follow. And we'll reiterate those at the end of the presentation, at the last session for today. So at least you have those to say this is what came out of a conference, and it may be able to influence how we choose our focus area and everything besides as we go along. Thank you very much.